Indian Prime Minister Narendra Modi today told officials to review plans to ease travel restrictions as concerns rise over the new Omicron variant of COVID-19. The world's second worst affected country by the pandemic had only on Friday decided to resume international passenger flights from countries deemed at risk of the coronavirus, while ordering tightening border screening.
The need for monitoring all international arrivals with a specific focus on countries identified at risk. The World Health Organization said Omicron, initially detected in South Africa, may spread more quickly than other forms.
The structural changes that have been observed in this newly reported emerging variant, that has certain changes which are indicative of possibility for adherence to the cellular receptors with increased affinity or transmission. There's a possibility. But whether it is getting transmitted really fast or it is causing clusters of infections, that require a little more time to come up.
This week, India posted the smallest rise in new cases in 1.5 years due to increased vaccinations and antibodies in a large section of its population from previous infections. The nation's daily caseload has halved since September. The country reported 8,318 new cases in the last 24 hours. But the new variant, with a spike protein dramatically different from the one existing coronavirus that vaccines are based on, has raised global alarms and frightened financial markets. Mumbai Mayor Kirushi Pednekar said quarantine was made compulsory for passengers coming from South Africa, adding that their COVID-19 test samples would be sent for genome sequencing.
The new coronavirus variant is a matter of concern in Mumbai. We have made quarantine compulsory for everyone coming from South Africa. However, flight services will not be halted because of the new variant found in South Africa. The sample of every person returning from South Africa will be sent for genome sequencing.
Modi said people must be more cautious and take proper precautions such as wearing masks and social distancing.
For more on this story, we're now joined by Dr. Rajib Dasgupta, the Chairperson of the Center for Social Medicine and Community Health at the Jawaharlal Nehru University. Dr. Dasgupta, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening.
Well, is the call to review the reopening of travelling or of the easing travel restrictions a mere knee-jerk reaction, or is it a necessary move at this stage?
Well, India had poised for a near normalization of international air traffic from 15 December. However, the Omicron, the emergence of this new variant has led to a rethink of sorts. And the Ministry of Civil Aviation has actually come up with a set of revised advisories. And that is in conjunction with advisories on international arrivals, particularly from a set of countries which have been labeled countries at risk, and that list is now about a dozen. And at the same time, most Indian states are certainly gearing up for a possible change in the epidemiological situation. And as the earlier report described, those are some of the preparations.
Not so long ago, Dr. Dasgupta, India reached 1 billion vaccinations of its population. Should the country be worried about the Omicron variant?
Well, India's worry at present, as far as vaccination goes, is the emerging complacency vis-a-vis the second dose. And it's quite clear, and therefore the government a few weeks back actually took a serious note of it. And currently, therefore, there are two immediate concerns and targets. One is to complete 90% immunization of the first dose by end of November, and to complete the second dose schedule of those who have already taken the first dose of the vaccine. In terms of the share of the total population, the current coverage of 2 doses stands a little less than a third of the population at about 31%, and coverage by a single dose is at about 57, 58%. So those really are the current concerns now.
And how much do we know about this new variant? And will the current vaccines that we have at our disposal be able to protect us from this?
Well, as we know, the evidence is emerging, and we are looking forward to much of the clinical evidence and the epidemiological experience from the South African physicians and the South African public health fraternity. And in fact, South Africa, Africa CDC have been constantly sharing and updating information. And as we know, by the current information, the clinical picture seems to be relatively mild. It's also the case that current vaccines and particularly current tests seem to be reasonably effective as far as this new variant goes. And I think one needs to make a distinction between the map and the terrain. Much of the current concern is around the mutations that this variant has, but to the extent to which it will translate into epidemiological challenges at the ground level is something that only emerging evidence will inform us. And that's been very clear, both from the African scientists and scholars and physicians, as well as the WHO's own position.
Well, the WHO says the variant has protein dramatically different from the original. What does it mean? Is it more lethal, perhaps?
Well, as we have seen with the earlier beta variants and the ongoing Delta variants, it can either be more transmissible or it can be more fatal. Now, if it is more transmissible, as we have seen with Delta, it will, in sheer statistical terms, cause great stress on health services, and it can overload the health services, and it can, in the worst cases, cause a havoc. However, even though numbers are very small, the evidence from the South African scientists, particularly the clinical experience, seems to be the case that this is a milder variant. It's causing a milder disease. It's largely limited, at least currently, to younger adults. And there are several ifs and buts, and it's a little early to comment or even to be able to definitively conclude whether this is more transmissible or whether this is more fatal. But then, as the position has been made very clear, that this current surge in cases, particularly in the Gauteng province, is in the backdrop of what's been termed, and very rightly so, as relaxed non-pharmaceutical interventions, which is mask, hand washing, physical distancing, etc. And that's certainly true of much of the world, including India. So it's really those background conditions that we really need to focus on, rather than some of the knee-jerk reactions that we are seeing in terms of travel bans.
So will we need new vaccines, or will the vaccinated people need to vaccinate again?
Again, as all the authorities are saying, and rightly so, that this is early days yet, and we really need to understand the emerging evidence, and that's what everybody is looking at, and including India, and I'm sure all over the world. It is still a little early to comment. It would, I suspect, vary from country to country, and even within at subnational levels in a country as diverse as India. Now, India's seropositivity is nearly 90% in many states, which is a combination of both the natural infection happening, particularly in a post-Delta situation, plus rising vaccination. Now, whether that would provide adequate evidence to this new variant, again, we'll have to watch and see.
You know, Dr. Dasgupta, there's questions around how quickly the new variant spreads and the level of transmissibility. What do we know about such?
I think what indeed seems to be the case that this is quite transmissible. This is certainly transmitting pretty fast. But if it's a combination of transmitting pretty fast, but at the same time remaining a mild disease, at least in the young adults, in the limited experience, then it's unlikely to be a major cause for concern. But if it's affecting the elderly and if it ends up causing more serious disease in the elderly or in those having other comorbidities, then that's something we certainly need to worry about. Sorry.
Well, epidemiologists have warned that travel curbs may be a little too late. Do you concur with those sentiments?
Can you repeat that, please?
Well, epidemiologists have said that, the travel bans or the travel curbs, as it were, may be a little too late. Do you agree with this sentiment?
Yes, in fact, there is a lot of rethink on whether these travel bans are at all justified, even in the epidemiological sense, because transmissions happen silently, transmissions happen under the radar, and if the evidence, if the current evidence is anything to go by, it is already being detected in several countries across the world. In India, there was some concern over 2 South African citizens being detected COVID positive, but only in the last few hours it's confirmed that they are Delta. I mean, those are Delta variant cases and not Omicron. And again, another case in Maharashtra, traveler back from South Africa, he's turned out to be positive. That's under investigation. So obviously these spread under the radar, and that's what the nature of almost all infections, and certainly a viral infection of this kind is. And travel bans, as we have seen, and again I repeat, as the Africa CDC put it very unequivocally, hasn't really been able to contain or limit spread in any discernible manner.
All right, Dr. Dasgupta, lovely chatting to you. Thank you so much for your analysis. That was Dr. Rajib Dasgupta, the chairperson of the Center of Social Medicine and Community Health at the Jawaharlal Nehru University.